Hi, my name is Debbie Callahan, and I am the mother of Kiera, who had surgery with Dr. Robert Lewis September of 2015. And I'm here to just describe a little bit about what our experience has been. Kiera got sick approximately 2014, 2015. She was a full-time college student and very active, auditioning and going to school full-time. And I noticed that there were certain things that started to change for her. She started to have rapid weight gain. She started to not feel well. Her energy level started to plummet. And this was someone that was very active in the dance community as well as in acting and singing. And has always been very active athletically. I became alarmed by the symptoms, and we went to our GP, and they also were concerned. They referred us to a series of endocrinologists, and then eventually 2 other large institutions in LA to figure out what was going on with Kiera. Unfortunately, we were fighting for a diagnosis, although instinctually I knew that something was terribly wrong, that it may very well be Cushing's disease. And they sent us through a battery of testing, and nothing really showed up. She had several MRIs, several blood work, and nothing was really outstanding. Occasionally she'd get some sort of blood work irregularity, but nothing consistent that would alarm the actual larger community. Those that were following her since she was 8 years old knew something was wrong because they had seen the dramatic change in her. It was trying to basically convince others outside of that, because we were really limited on what we could do, that there was something wrong. And so she was put on an experimental drug and had a severe allergic reaction to it. It was supposed to kind of bide us some time until we could get a firm diagnosis. I called Dr. Robert Lewis after 2 other consults, and they pretty much felt that she was too young to have Cushing's, and that there may be other things that were going on rather than really believing us per se of what our concerns were. We searched for Dr. Robert Lewis, and we looked him up and found that people had a great write-up. Patients felt very secure, and his outcomes were tremendous. I immediately called Janine, actually, for Dr. Lewis's office, and they said to us, I can get you in 2 days. She heard the panic in my voice because I didn't know what else to do. And at that time, Kiera's blood pressure soared to 180/100, and it was really, and she had a lot of other symptoms that were just spinning out of control. And I was really worried about what would become of her if we didn't get this taken care of. Dr. Lewis took us in right away, saw her, and I brought all of her MRIs, and he immediately put us at ease and said, listen, it's not surprising that it's not really showing up on the MRI, and it's not showing up in the blood work. She's so young that sometimes what happens is we were so on top of it as an early diagnosis. Most women don't realize. They just think I gained weight, and they put up with it for 10 years. But we knew immediately, within 2 years' time, we saw such a dramatic change that we had to do something. And so that's why her blood levels and her MRI never really showed up anything totally a little elevated, but not anything to any great degree. Within 6 weeks, Dr. Lewis said to me, we are going to get this taken care of. He said immediately, I want you to go for IPSS right here at Hoag, and we saw the neuroradiologist, and they set her up for an inpatient procedure called IPSS. And we did that, and then immediately after that, a week later, she was back in the office so that we could discuss the results. And at that time, they noticed that there was something terribly wrong with her pituitary. They saw a clump of cells that they believed could be the tumor, and it gave them enough validation to go in and to try to do the surgery, which was the transsphenodial approach. So within 6 weeks, we had a diagnosis, we had a plan, and we had our first surgery. Unfortunately, the first surgery, we knew within 24 hours that it was not successful. The tumor that he was looking for was a hormone-producing tumor. The cells that he had removed were not the hormone, and the only way that they could really figure that out was once they removed it to see if her cortisol levels had dropped. and it did not happen. So we knew that we had to come back. And what we decided to do was, after Dr. Lewis confirmed and sent the pathology to the Mayo Clinic, as well as calling the University of Virginia, his contacts down there, and they all said, go back in within 2 weeks, let's wait for the pathology to come back. At which point it did come back, and it was highly an aggressive form of Cushing's disease, and it gave them the clarity to go back in and say that we have to find this. Unfortunately, these adenomas are smaller than a pinhead, and that's what makes it most difficult to find. So he had to basically go through her whole entire pituitary to locate where else these things could possibly be. The second surgery went much easier than the first. First surgery, her body really had a very difficult time adjusting and adapting, and she has a baseline inflammation from the cortisol. Well, it just, the trauma of the surgery really made her much more debilitated, and required a walker and 24-hour care at home. I mean, it was really such a stunning shock to see the outcome of the first surgery. But we went in the second time after 2 weeks, and she was walking 2 hours after the surgery, totally awake in recovery, and she felt good. Inside she knew, I think they got everything. I feel differently this time around. I think the amazing part of Dr. Lewis is he's such a skilled neurosurgeon, but also he has a great balance between his knowledge of neurosurgery and endocrinology. And I think in this type of diagnosis, you need to have that type of skill level. And he's also amazing with the transsphenodial approach, which helps with limiting the post-op recovery time. And also, we knew immediately within 24 hours whether we had gotten the tumor or not. The team is great. He's got a great team that's put together between ENT and himself, as well as Lori, who also saw us beforehand for support, and also in the hospital. She was there every day for us, as well as post-operatively, and continuing on with just post-op care as far as support, and because we know it's a lengthy process with multiple medication adjustments. And people don't realize that the pituitary is the key gland of the whole entire body and how many systems it affects. And so those things have to be monitored very carefully. So with the endocrinologist, the neurologist, and the ENT, and the support, we've got a great comprehensive plan here, and a treatment plan, and a team, which I can say I don't see anywhere else in the state of California, because we have gone to the other two facilities and they could not provide that for us. And I think that helps with a quicker recovery all the way around. And Kiera has a great sense of hope, and we all do, as far as the future. It looks a lot brighter and a lot more positive. Her energy has returned. And she's now trying to make a larger impact. She's decided not to continue on with her entertainment part of it, but to use her skill set to have a greater impact on those that have journeyed just like we have. And she's looking at a pre-med with a specialty in endocrinology. So yeah, I'm very grateful for this team and for the staff, and the office runs so efficiently, and that also was a great relief for me, knowing that we were in great hands, and that when Dr. Lewis makes an appointment or has whatever his contacts are, everyone seems to move very quickly and with great respect for him. They love working with him. Nurses have come up to me and said, "You have a great team," and that was very, very reassuring to us after what we had gone from before. Yeah, I'm very grateful, and I feel very blessed that we're part of this team, and that we can make an impact on those that are moving forward as well as an example to others. So thank you.